Hi everyone, my name is Kate Carr. I'm one of the family navigators here at the St. Louis Arc. Today I'm kind of going to talk about steps to getting an autism diagnosis for a child. So this would be 0 to most likely 17, maybe 18 years old. It can be a pretty rigorous process, so I tried to outline it as detailed and easily as possible to kind of show you a math and way that normally these are the ways you would get a diagnosis. It can take some time, but hopefully these steps will kind of help get you to the right person or step. So the very first step in getting a diagnosis is monitoring. A lot of times this can be done at home. You can kind of write down some of your concerns that you're seeing with your child and let the pediatrician know that. Normally at the 18-month doctor's visit or pediatrician visit, they will do normally it's like a one-page screener asking you a few questions. And again, if you have any concerns anytime, feel free to let your child's pediatrician know just so that they're aware and kind of can keep that communication going. So once you've done some of the monitoring, you've taken some data on your kiddo, maybe the pediatrician has, maybe school has, depending on the age. The next step in that is a screening. And that can happen. I believe it starts at 18 months, where the pediatrician will hand you that like one pager, kind of asking you some specific questions. And again, with autism, maybe you're not seeing something, maybe you just don't know. And hey, I'm 5 years old and needing it. So it's not necessarily that it has to be at 18 months, but that's typically when pediatricians will provide that screening page to you, where you can write down any information you have. But again, this can happen at any time you're comfortable or thinking you're needing this. Next step again is the developmental screening. Typically, a pediatrician will provide that at the well visit, or you can ask for one to be sent to you. Once that's kind of been reviewed to identify possibly some delays, the next step is going to be a referral for testing. And this is where it can take some time. You would want to reach out to obtain a neuropsych eval or test. And typically, the physicians or providers that will do the testing are going to be developmental pediatricians, a neuropsychiatrist, a neuropsychologist, psychiatrist, neurologist, or a psychologist. There are various different places in St. Louis and throughout the area that have centers, hospitals, or private places that can also, you can get testing done as well as screenings. And then once that referral has been requested and put in, next is going to be testing. So dependent on the age of the child and kind of some things that you're noticing, maybe the pediatrician is noticing, it can make the test longer or shorter. So typically these tests are anywhere from an hour to 4 hours. Again, it's dependent on the child and the provider doing the test, but the specific test that's done, an ADOS assessment, this helps identify some of those primary or core areas of autism that we see. And some of those areas are communication, different repetitive behaviors, how someone interacts with others in the community, and restricted interests. Again, there can be more. These are just the pretty common and main ones that they will focus on. Next, once the testing has been done, you will meet with whoever performed the test to kind of go over what the provider physician saw, what are some recommendations, what do we do? I don't know. So that is when a very, very extensive narrative will be sent to you. You can go over with the provider to kind of talk about what are recommendations. It'll frame out your child's developmental history from pre-birth to birth to infancy to depending how old the child is up until that age. It'll also discuss the test result. So what the provider physician finds, and they will go in detail over that to give any recommendations if there are future services that could support your kiddo. They will possibly talk about those as well, who to contact. Um, and they might even give the last page might be a list of recommendations with here, these are some people you can reach out to. Again, you do not have to reach out to those people. Those are just recommendations. And you can reach out however early or late as you want. It's up to you. There's no one size fits all, which is kind of tricky about it because there can be different options dependent on situation, the child, and what you think is best. So the next steps, again, kind of what I've been saying, will support your child's growth and development, present, future, long term. And this is where you can kind of take some time to process and just understand and learn. It's going to be a lot. And again, there's no one size fits all. But if you're comfortable, please reach out to any organization that can offer some support or request to speak with a family navigator. The St. Louis ARC, we have quite a few navigators that can support as well as other agencies do. We have a few different support groups that are geared towards life ranges or ages from 0 to aging, which is really great. Depending on the age, you can kind of find some groups and other people of similar interest or concerns and make a network of people so you don't feel alone. And I think the biggest thing of this is just take time for you and your family. It's a lot to take in. And if anything, your well-being and health is just as important as your loved ones that's just gotten a diagnosis. So making sure that you feel connected and well represented and understand. And if you have any questions, again, feel free to reach out to an organization such as the ARC and request family navigation. We are here and happy to support. Have a wonderful day.